Hi again, it's Gillian here from the Stroke Research Register in Newcastle, New South Wales, Wabbequaland. And I've got with me Dina, who's a physio who's in Melbourne. She's come on board with Team English to work on a PhD project. Can you tell us a bit about what you're doing?
Hi, Gillian. Thanks so much for having me. Really exciting project. We're hoping to design an online platform or a website where stroke survivors can go to get additional information about how to better look after themselves long term. We're hoping that this website will provide, as we said, information, but also that it's accessible and it's easy to engage with, so easy to use. And the reason, I guess, that we want to do this body of work is because in my current job, I find that we see clients in the community, so we see patients who come through our service, but then when they finish up with their rehab, there's really not much else out there to support our stroke survivors long term. So we're hoping that this will be a really good resource for people after they've had their structured care and something that they can tap in and tap out of as they feel they need to. So really exciting project. Super excited to have everybody involved.
That sounds really useful because we were having a conversation about this before, and you were saying how it seems, stroke is a long-term problem, and it just seems so unfair that if you can't get to the hospital rehab program, or if that finishes and you still have improving to do, and it's still harder for you to exercise maybe than the next person, like there's no support. So this program being online, you're wanting to design it so it's easy to use. It just sounds like really great.
Oh, thanks, Jill. No, that's exactly what we're hoping for. We're hoping that it becomes available to anybody who wants to use it. So whether they are a morning person or an evening person, whether they live rurally or in a city. We've got so many stroke patients who struggle to get in and out of the car, to get themselves to an appointment. This just takes that away. It means that everybody can access the service and they can do it on their terms, which we're really, really excited to work towards.
Yeah, that's awesome, because you're definitely not trying to replace having that face-to-face option. It's just at the moment, there's only a certain amount of health professionals, right, and then a certain amount of facilities. So this should be extra for people.
Absolutely.
I'm interrupting, sorry, but you're looking for people to come and help you design it as well.
Yes, yeah, that would be really, we don't think this program will work unless we have the input from stroke survivors in designing from the very beginning.
Yep.
It's not a program for us, it's a program for stroke survivors to use. And the best way we know with the previous work that's been done with this team, that the best way to design something that works for people with stroke is to ask people with stroke to help us design it. So we're really excited to work with the stroke community, multicultural stroke survivors with aphasia. We welcome people who haven't had much computer experience before. We want to know what will work for them, because that's the best way to design a program that meets their needs.
Yeah, fantastic. Thanks for taking the time to chat with me today. We're going to see a bit more of you on the social channels. So if you've got any questions for Dina, feel free just to put a comment down underneath or get in touch with us, email. I'll put the Stroke Register email and phone number in the comments below. So yeah, get in touch. You'll see different bits and pieces about this project and updates as we go along. We'll talk to you again soon.
Thanks so much, Gillian. Really appreciate your support.
See ya.